Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Ashley Rollins, who is my colleague at Family Practice Associates and double boarded in internal medicine and pediatrics. Welcome.
Thank you.
All right, now we got summertime coming up, and there's a lot of illnesses to talk about that occur mostly in summertime. So
Yes,
when we
sir.
talk about summertime, let's talk about sunburn, sunscreens. Why wear a sunscreen?
Well, the primary reason is to prevent a sunburn. The issues with sunburn are obviously it can cause damage to the skin, which long term can predispose you to developing certain types of skin cancer, such as melanoma. There are a wide variety of other cancers and precancers of the skin that we also like to guard against with sunscreen.
So when you mentioned sunscreen, I mean, I just went to Florida and I looked at sunscreens and they got 3, 8, 10, 12, and 70 and 100 now.
Right.
Is there a difference, and is it important to wear?
It is. It's very important to wear. The difference probably that you're looking at would be the SPF, and that's the sun protection factor. And so that gives you an indication of how well and how long you're going to be protected while being in the sun. So typically the recommendation is to use at least an SPF 30. I typically recommend for the face 50 or higher because that's going to give you a little bit longer protection. You want to look for a broad spectrum sunscreen, so that covers against UVA and UVB rays. And then typically I'll recommend, particularly for children, a mineral-based sunscreen without any benzene in it.
Okay. Now, benzene, I think, is a chemical that you're concerned
Yes.
about, but also with insect bites in the summertime, they can cause diseases. Do you wear repellents, or what insects do we worry about?
Well, there are a lot of different insects, especially in Kentucky this time of year, but particularly the disease-carrying insects such as mosquitoes or ticks are some that we kind of guard against, the so-called biting insects. And we do recommend insect repellent for those, particularly if you're going to be outside in a wooded or damp area for a prolonged period of time. You know, the big kind of reminder I always give, especially parents, about insect repellent is, you know, you don't want to use anything with DEET under the age of 6 months, but over the age of 6 months, and for adults it is recommended because that's going to give you your best protection against insect bites.
Okay, now I can't let you get out of here without talking about COVID. So
Sure.
we're also into the middle of allergy season. There's pollens and all this stuff everywhere in the environment. So people have got runny noses and all kinds of symptoms. How can you tell the difference between COVID and allergies, or should you even be worried?
Well, you know, you hate to say worried, but I will say that there's quite a bit of overlap between the two. And so if you are feeling or noticing anything other than your sort of typical run-of-the-mill allergy symptoms, or if you have any concern that you could have been exposed to COVID, the safest thing to do is to get tested or, you know, talk to your primary care doctor about it. Particularly, you know, fevers are not a part of allergies. Shortness of breath, unless you have asthma, should not be a part of what you would experience with allergy symptoms. So anything like that should be further evaluated.
So if it's just ordinary allergies, because we hear about COVID every day, so allergies now, there's some things you can take over the counter to kind of make those symptoms better.
Absolutely, yeah. You know, there are plenty of non-drowsy antihistamines that you can choose from over the counter. That would be something like Zyrtec or Claritin or Lager, the generic form of those. You know, we have those available for children as well. Just talk with your pediatrician about, you know, dosing options and what you should choose. You know, of course, we also have nasal sprays, which can kind of help reduce some of the runny nose associated with allergy symptoms as well.
All right, real quickly, something that mostly is summertime is poison ivy. Even though it's not a big deal, but some people it just drives crazy.
Yes.
What can you do about it?
Well, you know, the first thing to do is after you notice that you've been exposed, make sure that you wash the skin well to kind of keep it clean, prevent any secondary infections. You can take over-the-counter antihistamines similar to the, you know, the Zyrtec and Claritin that we talked about. Benadryl also helps, and those are going to help with the itching. Topical steroids such as cortisone cream, you can use those for a short period of time to kind of help resolve the itching as well. If you get any redness or swelling of the skin, or if it's I would say if it's covering significant portions of your body, I would seek care from your primary care doctor as well, because you may need steroids or further treatment.
Okay. That's great information for summertime illnesses. Thanks for coming in.
Yes, sir.
We'll be right back.